Hi everyone, this is Nurse Anna from nursestudy.net. Today we have 80 NCLEX fluid and electrolyte practice questions. I put together a free NCLEX survival study guide to help you stay organized and confident. Feel free to download it with the link below. And if you want more resources, we have study guides and free nursing audiobooks in our store. You'll find all of those links in the description. Question 1. A 72-year-old patient with heart failure is receiving 0.45% saline at 125 milliliters per hour for hypernatremia. The patient suddenly develops crackles in both lung bases, dyspnea, and oxygen saturation of 88%. What is the nurse's priority action? A. Slow the IV infusion rate and notify the provider. B. Increase the IV infusion rate to correct sodium imbalance faster. C. Encourage the patient to cough and deep breathe. D. Place the patient in high Fowler's position only. Correct answer, A. Rationale. The patient is developing fluid overload from hypotonic fluids. The nurse must slow the infusion and notify the provider. Increasing fluids worsens overload. Positioning alone does not address the cause. Coughing or deep breathing will not improve pulmonary edema. Question 2. A patient with DKA is receiving IV insulin and large volume normal saline boluses. Labs now show potassium 3.1 milliequivalents per liter, sodium 132 milliequivalents per liter, serum glucose 246 milligrams per deciliter. What is the nurse's priority? A. Administer IV potassium as ordered and place the patient on cardiac monitoring. B. Continue insulin infusion at current rate. C. Restrict sodium intake. D. Prepare the patient for possible intubation. Correct answer, A. Rationale. As insulin lowers glucose, potassium shifts intracellularly, leading to dangerous hypokalemia. Immediate replacement and monitoring are required. Insulin should continue, but hypokalemia must be corrected first for safety. Question 3. A patient with severe vomiting presents with muscle cramps, positive Chvostek's sign, and a prolonged QT interval. Which electrolyte imbalance is most likely? A. Hypercalcemia. B. Hypocalcemia. C. Hyperkalemia. D. Hypermagnesemia. Correct answer, B. Rationale. Hypocalcemia is associated with neuromuscular excitability, positive Chvostek's sign, and QT prolongation. Vomiting leads to metabolic alkalosis, can lead to decreased ionized calcium. Other options do not match the symptom cluster. Question 4. A patient with chronic kidney disease reports weakness and palpitations. The ECG shows peaked T waves. What is the nurse's priority intervention? A. Administer oral calcium carbonate. B. Increase dietary potassium. C. Initiate continuous cardiac monitoring and prepare to give calcium gluconate. D. Encourage ambulation. Correct answer, C. Rationale. Peaked T waves indicate severe hyperkalemia. Life-threatening dysrhythmias may occur. Cardiac stabilization with calcium gluconate is a priority. Increasing potassium worsens the condition. Ambulation is irrelevant. Question 5. A patient receiving loop diuretics for pulmonary edema now has the following labs: potassium 2.9 milliequivalents per liter, magnesium 1.3 milligrams per deciliter. Which finding requires immediate intervention? A. Reports of muscle weakness. B. Decreased bowel sounds. C. Premature ventricular contractions. PVCs on telemetry. D. Blood pressure 148 over 82 millimeters of mercury. Correct answer, C. Rationale. Hypokalemia and hypomagnesemia increase dysrhythmia risk. PVCs can progress to lethal arrhythmias and require urgent intervention. Weakness and decreased bowel sounds are expected findings but not emergent. Question 6. A patient with cirrhosis and ascites is prescribed spironolactone. Which finding indicates the medication is effective? A. Serum sodium increases from 130 to 138 milliequivalents per liter. B. Serum potassium decreases from 5.0 to 3.8 milliequivalents per liter. C. Weight decreases by 2 kilograms over 24 hours. D. Blood pressure increases from 110/70 to 140/90 millimeters of mercury. Correct answer, C. Rationale. Spironolactone removes excess fluid by antagonizing aldosterone. Weight loss reflects reduced fluid retention. Potassium should increase, not decrease. Blood pressure increase is not a therapeutic goal. Question 7. A patient presents with confusion, headache, nausea, and serum sodium of 118 milliequivalents per liter after excessive water intake. What is the nurse's priority action? A. Encourage oral salt intake. B. Prepare to administer hypertonic saline as ordered. C. Restrict fluids to 1 liter per day. D. Insert a Foley catheter to monitor output. Correct answer, B. Rationale. Severe symptomatic hyponatremia, sodium less than 120, with neurological changes requires cautious hypertonic saline to prevent cerebral edema. Fluid restriction helps long term, but immediate correction is needed. Question 8. A patient on magnesium sulfate for eclampsia has a respiratory rate of 8 per minute, absent deep tendon reflexes, and magnesium level of 7.5 milligrams per deciliter. What is the nurse's priority? A. Stop the infusion and administer calcium gluconate. B. Continue the infusion and monitor hourly. C. Notify provider and request increased dosing. D. Place the patient in high Fowler's position. Correct answer, A. Rationale. The patient is experiencing magnesium toxicity, loss of reflexes, and respiratory depression. Calcium gluconate is the antidote. Positioning or increasing dose is unsafe. Question 9. A patient with severe diarrhea is admitted with potassium 2.7 milliequivalents per liter and serum bicarbonate of 18 milliequivalents per liter. Which assessment finding requires immediate intervention? A. Flat T waves on ECG. B. Blood pressure 98/60 millimeters of mercury. C. Weak hand grips. D. Dry mucous membranes. Correct answer, A. Rationale. Hypokalemia with ECG changes indicates risk for lethal ventricular dysrhythmias. This is the most urgent complication. Mild hypotension, weakness, and dryness are expected but less emergent. Question 10. A postoperative patient receiving D5W at 125 milliliters per hour becomes restless, confused, and develops bounding pulses. Labs reveal sodium 128 milliequivalents per liter and serum osmolality 260 millismoles per kilogram. What contributed to this patient's condition? A. Administration of isotonic fluids. B. Rapid infusion of hypotonic fluids causing water intoxication. C. Insufficient fluid intake. D. Excessive sodium intake. Correct answer, B. Rationale. D5W metabolizes into free water, acting hypotonic. Rapid infusion can dilute sodium, leading to cerebral edema and neurological changes. The other options do not match the mechanism. Question 11. A patient with severe dehydration is receiving rapid IV normal saline. After 30 minutes, the nurse notes new onset crackles, tachypnea, and a drop in oxygen saturation from 96% to 90%. What is the nurse's priority action? A. Stop the infusion and notify the provider. B. Continue rapid infusion until blood pressure stabilizes. C. Encourage incentive spirometry. D. Obtain a urinalysis. Correct answer, A. Rationale. The patient is developing fluid overload despite dehydration. Pulmonary compromise requires stopping fluids and contacting the provider. The other options do not address the acute deterioration. Question 12. A patient with a serum sodium level of 160 milliequivalents per liter is confused, agitated, and extremely thirsty. Which physician order should the nurse question? A. Start 0.45% saline at 100 milliliters per hour. B. Restrict sodium intake. C. Administer D5W at 150 milliliters per hour. D. Administer 3% saline. Correct answer, D. Rationale. Hypernatremia should not be treated with hypertonic saline, 3%, which would worsen the condition. Hypotonic solutions such as half normal saline or D5W are appropriate. Question 13. A patient with chronic alcoholism has magnesium 1.0 milligrams per deciliter and potassium 3.0 milliequivalents per liter. After potassium replacement, the potassium level remains unchanged. What is the nurse's priority action? A. Request an additional potassium bolus. B. Administer magnesium replacement as ordered. C. Increase oral potassium intake. D. Restrict fluids until potassium stabilizes. Correct answer, B. Rationale. Hypomagnesemia makes potassium replacement ineffective. Magnesium must be corrected before potassium stabilizes. Increasing potassium intake alone will not resolve the issue. Question 14. A patient with Addison's disease presents with weakness, nausea, and a potassium level of 6.2 milliequivalents per liter. Which intervention is the nurse's priority? A. Start IV normal saline. B. Prepare to administer insulin with dextrose. C. Instruct the patient to avoid salt. D. Place the patient on a high potassium diet. Correct answer, B. Rationale. Addison's disease can cause life-threatening hyperkalemia. Insulin with dextrose shifts potassium intracellularly quickly. Other options do not address immediate risk. Question 15. A patient with pancreatitis has a calcium level of 7.6. Which assessment finding requires immediate intervention? A. Numbness around the mouth. B. Positive Trousseau sign. See Strider. D. Hyperactive bowel sounds. Correct answer, C. Rationale. Strider indicates laryngeal spasm from severe hypocalcemia and airway emergency. The other findings confirm hypocalcemia but are not immediately life-threatening. Question 16. A patient with severe diarrhea and dehydration is receiving lactated Ringer's solution. Which finding indicates the therapy is effective? A. Serum potassium decreases from 3.2 to 2.8 milliequivalents per liter. B. Serum bicarbonate increases from 17 to 22 milliequivalents per liter. C. Blood pressure decreases from 110/70 to 90/60 millimeters of mercury. D. Urine output decreases to 15 milliliters per hour. Correct answer, B. Rationale. LR contains lactate, which converts to bicarbonate and helps correct metabolic acidosis from diarrhea. The other findings reflect worsening fluid status. Question 17. A patient on TPN develops sudden restlessness, muscle twitching, and tachycardia. Labs show magnesium 0.9 milligrams per deciliter and calcium 7.8 milligrams per deciliter. What is the nurse's priority? A. Decrease the TPN rate. B. Prepare to administer magnesium sulfate. C. Offer oral calcium supplements. D. Encourage the patient to ambulate. Correct answer. B. Rationale. Severe hypomagnesemia can cause dangerous arrhythmias and neuromuscular irritability. IV magnesium is required immediately. Question 18. A patient with SIADH has serum sodium of 121 milliequivalents per liter, decreased urine output and weight gain. Which order should the nurse implement first? A. Restrict fluids to 800 milliliters per day. B. Administer furosemide as ordered. C. Assess for neurological changes. D. Place the patient on seizure precautions. Correct answer. C. Rationale. Serum sodium near 120 places the patient at high risk for seizures and brain swelling. The first priority is assessing for neurological decline, clinical judgment step, recognize cues, so interventions can be escalated immediately. Question 19. A patient receiving IV potassium chloride reports burning at the IV site. The IV site appears red and warm. What is the priority action? A. Slow the IV infusion. B. Stop the infusion and assess the site. C. Apply a warm compress. D. Flush the IV with normal saline. Correct answer. B. Rationale. Burning and redness indicate possible infiltration or phlebitis. Potassium is a vesicant. Infusion must be stopped immediately. Flushing could worsen tissue injury. Question 20. A patient with acute kidney injury has BUN 70 milligrams per deciliter, creatinine 4.8 milligrams per deciliter, potassium 5.9 milliequivalents per liter, and reports tingling in the hands and feet. What is the nurse's priority? A. Restrict the patient's oral fluid intake. B. Administer sodium polystyrene sulfonate as ordered. C. Start IV lactated ringers at 150 milliliters per hour. D. Encourage the patient to increase protein intake. Correct answer. B. Rationale. Hyperkalemia associated with kidney injury can cause lethal dysrhythmias. Sodium polystyrene sulfonate helps remove potassium from the body. Fluid boluses and high-protein diets are contraindicated. Question 21. A patient with acute gastroenteritis has had vomiting and diarrhea for 3 days. Labs reveal sodium 130 milliequivalents per liter, potassium 2.9 milliequivalents per liter, and urine-specific gravity of 1.035. Which intervention is the nurse's priority? A. Administer ordered potassium chloride IV via infusion pump. B. Encourage oral clear fluids. C. Initiate fluid restriction. D. Provide sodium-rich foods. Correct answer. A. Rationale. Hypokalemia, potassium less than 3.0, with GI losses requires urgent IV potassium replacement to prevent arrhythmias. Fluid restriction worsens dehydration. Oral fluids alone are insufficient for severe electrolyte loss. Question 2022. A patient receiving 3% hypertonic saline for severe hyponatremia develops new tremors, hypertension, and shortness of breath. Which action is the nurse's priority? A. Stop the infusion and notify the provider. B. Lower the bed and place the patient supine. C. Continue infusion until sodium level normalizes. D. Encourage coughing and deep breathing. Correct answer. A. Rationale. Hypertonic saline can cause fluid overload and pulmonary edema. New neurological and respiratory symptoms require stopping the infusion immediately. Question 23. A patient with diabetic ketoacidosis is on an insulin drip. Labs show potassium decrease from 4.2 to 3.1 milliequivalents per liter. Which order should the nurse implement first? A. Increase the insulin rate. B. Administer IV potassium as ordered. C. Evaluate urine output. D. Check the serum bicarbonate level. Correct answer, B. Rationale. Insulin causes potassium to shift intracellularly, leading to hypokalemia. Potassium replacement is urgent to prevent dysrhythmias. The insulin infusion continues, but hypokalemia must be treated immediately. Question 24. A patient with end-stage renal disease is admitted with potassium 6.5 milliequivalents per liter, peak T waves, and irregular rhythm. The provider orders calcium gluconate, insulin with dextrose, and sodium polystyrene sulfonate. What is the nurse's priority action? A. Administer calcium gluconate. B. Administer sodium polystyrene first. C. Hold all medications until ECG repeats. D. Apply oxygen at 2 liters per minute. Correct answer, A. Rationale. Calcium gluconate stabilizes the myocardium immediately, preventing lethal dysrhythmias. Insulin shifts potassium next. Sodium polystyrene removes potassium slowly. Question 25. A postoperative patient receiving IV D5W at 150 milliliters per hour becomes increasingly confused and lethargic. Sodium is now 122 milliequivalents per liter. What contributed to this condition? A. Administration of a hypotonic solution. B. Lack of oral fluid intake. C. Administration of an isotonic fluid. D. Excess dietary sodium intake. Correct answer, A. Rationale. D5W becomes free water in the body and acts hypotonic. Rapid infusion dilutes sodium, causing water intoxication and cerebral edema. Question 26. A patient with severe burns is receiving large volumes of lactated Ringer's. Which finding indicates that fluid resuscitation is effective? A. Urine output increases to 45 milliliters per hour. B. Heart rate increases from 102 beats per minute to 118 beats per minute. C. Blood pressure decreases to 98/60 millimeters of mercury. D. Serum potassium increases from 4.0 to 6.0 milliequivalents per liter. Correct answer, A. Rationale. Adequate urine output, 30 to 50 milliliters per hour, is the best indicator of improved perfusion following burn resuscitation. Tachycardia, low blood pressure, and hyperkalemia indicate worsening shock. Question 27. A patient with acute pancreatitis is receiving aggressive IV fluids. Which assessment finding requires immediate intervention? A. New bilateral crackles. B. Left upper quadrant abdominal pain. C. Elevated serum lipase. D. Mild nausea. Correct answer, A. Rationale. Crackles may indicate fluid overload and incipient pulmonary edema requiring immediate action. Pain, lipase elevation, and nausea are expected findings in pancreatitis. Question 28. A patient receiving IV magnesium sulfate for preeclampsia has magnesium level 6.8, urine output 20 milliliters per hour, and respiratory rate 10 per minute. What is the nurse's priority action? A. Administer calcium gluconate antidote. B. Decrease the magnesium infusion rate. C. Increase IV fluids to improve urine output. D. Encourage deep breathing exercises. Correct answer, A. Rationale. The patient has magnesium toxicity. Respiratory depression and low urine output require immediate reversal with IV calcium gluconate. Question 29. A patient with chronic diarrhea has sodium 128 milliequivalents per liter, potassium 2.8 milliequivalents per liter, and bicarb 16 milliequivalents per liter. Which acid-base imbalance should the nurse expect? A. Metabolic alkalosis. B. Metabolic acidosis. C. Respiratory acidosis. D. Respiratory alkalosis. Correct answer, B. Rationale. Diarrhea causes loss of bicarbonate, producing metabolic acidosis. This matches the low bicarb level. Question 30. A patient is receiving IV potassium chloride through a peripheral IV at 10 milliequivalents per hour. The patient reports burning at the site, but the IV flushes easily. What is the nurse's priority action? A. Slow the infusion and reassess. B. Stop the infusion and remove the IV. C. Apply a cold compress. D. Increase the infusion to complete treatment quicker. Correct answer, A. Rationale. Burning is common with potassium infusions. The nurse should slow the infusion to relieve discomfort. If signs of infiltration occur, the IV must be stopped and restarted elsewhere. Increasing rate is unsafe. Question 31. A patient with severe dehydration is receiving normal saline at 200 milliliters per hour. After 2 hours, the patient's blood pressure increases from 82/50 to 118/76 millimeters of mercury, but new jugular vein distension and tachypnea develop. What is the nurse's priority action? A. Slow the IV infusion and notify the provider. B. Continue infusion until full stabilization is achieved. C. Encourage coughing and deep breathing. D. Place the patient in Trendelenburg position. Correct answer. A. Rationale. The patient is showing signs of fluid overload from aggressive resuscitation. JVD and tachypnea require slowing the infusion. Trendelenburg and coughing do not address pulmonary congestion. Question 32. A patient with hyperparathyroidism has calcium of 12.0 and reports muscle weakness and constipation. Which intervention is the nurse's priority? A. Administer intravenous fluids to promote calcium excretion. B. Provide a calcium-rich diet. C. Restrict fluid intake. D. Encourage bed rest. Correct answer, A. Rationale. Hypercalcemia causes dehydration and increases risk of renal stones. IV fluids enhance renal excretion. The other options worsen hypercalcemia or increase complications. Question 33. A patient receiving TPN suddenly develops confusion, irritability, and bounding pulses. Serum sodium is 124 milliequivalents per liter. Which action should the nurse take first? A. Pause TPN and assess the patient's airway and neurological status. B. Continue TPN and restrict fluids. C. Administer a diuretic immediately. D. Encourage oral electrolyte drinks. Correct answer, A. Rationale. TPN can cause dilutional hyponatremia. Acute confusion and bounding pulses indicate possible cerebral edema. First priority is to stop harmful input and assess airway and neuro status. Question 34. A patient with DKA has the following labs after 4 hours of treatment: potassium 2.8 milliequivalents per liter, pH 7.28, bicarb 15 milliequivalents per liter. What is the nurse's priority action? A. Hold insulin. Replace potassium as ordered. B. Increase IV insulin rate. C. Administer sodium bicarbonate. D. Start a diuretic. Correct answer, A. Rationale. Insulin will drive potassium lower, worsening hypokalemia. The insulin infusion should be paused until potassium is corrected. Bicarbonate is not first line unless acidosis is severe, less than 7.0. Question 35. A patient presents with muscle cramps, tetany, and a prolonged QT interval. The nurse suspects hypocalcemia. Which condition is a likely cause? A. Acute pancreatitis. B. Chronic kidney stones. C. Hyperparathyroidism. D. Excess vitamin D intake. Correct answer. A. Rationale. Acute pancreatitis causes fat necrosis and binds calcium, leading to hypocalcemia. Hyperparathyroidism and excess vitamin D cause hypercalcemia, the opposite finding. Question 36. A patient with cirrhosis and ascites is receiving albumin infusion. Which finding indicates the treatment is effective? A. Increased urine output. B. Decreased blood pressure. C. Pitting edema increases. D. Serum sodium decreases. Correct answer. A. Rationale. Albumin draws fluid back into the vascular space, improving perfusion and increasing urine output. Worsening edema or hypotension indicates ineffective treatment. Question 37. A patient receiving IV furosemide reports ringing in the ears and dizziness. The latest labs show potassium 3.0 milliequivalents per liter and magnesium 1.1 milligrams per deciliter. What is the nurse's priority action? A. Stop the furosemide infusion. B. Encourage oral potassium supplements. C. Increase the furosemide rate to improve diuresis. D. Restrict dietary magnesium. Correct answer. A. Rationale. Furosemide can cause ototoxicity, especially in the presence of low magnesium and potassium. The infusion should be stopped immediately. The diuretic should not be increased. Question 38. A patient has received several liters of 3% normal saline for septic shock. Now the patient's sodium is 150 milliequivalents per liter and the patient reports extreme thirst. What is the priority intervention? A. Switch IV fluids to half normal saline. B. Continue normal saline. C. Restrict oral fluids. D. Administer 3% hypertonic saline. Correct answer. A. Rationale. Hypernatremia after large volume isotonic fluids requires switching to a hypotonic solution for gradual correction. Hypertonic saline worsens hypernatremia. Question 39. A patient with chronic kidney disease reports nausea and has potassium 6.1 milliequivalents per liter. The ECG shows wide QRS complexes. What should the nurse do first? A. Prepare to administer IV calcium gluconate. B. Offer a low potassium snack. C. Place the patient in semi-Fowler's position. D. Check magnesium levels. Correct answer. A. Rationale. Wide QRS complexes indicate severe hyperkalemia with cardiac instability. Calcium gluconate stabilizes the myocardium and prevents fatal dysrhythmias. Question 40. A patient with severe vomiting has sodium 150 milliequivalents per liter, urine output 10 milliliters per hour, and dry mucous membranes. Which intervention is the priority? A. Administer isotonic fluid bolus. B. Restrict fluids until nausea resolves. C. Provide oral rehydration with electrolyte drinks. D. Insert an NG tube for suction. Correct answer. A. Rationale. The patient has dehydration with prerenal oliguria. Rapid isotonic fluid replacement is required to restore circulating volume. Restricting fluids or oral intake is inappropriate in severe dehydration. Question 41. A patient with pneumonia is receiving large volume IV fluids to treat hypotension. 6 hours later, lung sounds reveal new crackles, and O2 saturation has dropped to 89%. Which action is the nurse's priority? A. Slow the IV infusion rate and notify the provider. B. Encourage coughing and deep breathing. C. Continue fluids until blood pressure is completely stable. D. Obtain a sputum culture. Correct answer. A. Rationale. New crackles and hypoxia indicate fluid overload and worsening gas exchange. Slowing fluids prevents further pulmonary edema. Positioning or airway clearance does not resolve the cause. Question 42. A patient with multiple blood transfusions develops tingling, muscle twitching, and a positive Trousseau sign. Which electrolyte imbalance is most likely? A. Hyperkalemia, B. Hypocalcemia, C. Hypermagnesemia, D. Hypernatremia. Correct answer. B. Rationale. Citrate in stored blood binds calcium, causing hypocalcemia. Neuromuscular irritability and positive Trousseau sign confirm the diagnosis. Question 43. A patient with severe hyponatremia is receiving 3% saline. Which assessment finding requires immediate intervention? A. Serum sodium increases from 118 to 122 milliequivalents per liter in 2 hours. B. Headache and vomiting. C. Dry mucous membranes. D. Fatigue and irritability. Correct answer. A. Rationale. Sodium must be corrected slowly to prevent osmotic demyelination. An increase greater than 8 to 10 milliequivalents per liter in 24 hours is dangerous and requires stopping or slowing therapy. Question 44. A patient with acute kidney injury has potassium 6.3 milliequivalents per liter and reports palpitations. Which provider order should the nurse implement first? A. Obtain serum magnesium level. B. Administer IV calcium gluconate. C. Administer oral sodium polystyrene sulfonate. D. Begin continuous cardiac monitoring. Correct answer. B. Rationale. Calcium gluconate stabilizes cardiac membranes immediately, preventing lethal dysrhythmias. Other interventions do not provide rapid stabilization. Question 45. A patient with vomiting and NG suction has sodium 150 milliequivalents per liter and urine output 20 milliliters per hour. Which fluid should the nurse anticipate administering? A. 0.45% normal saline. B. 3% saline. C. D5NS. D. Lactated ringers. Correct answer. A. Rationale. Hypernatremia from fluid loss requires hypotonic fluids such as 0.45% NS to replace free water gradually. Hypertonic saline worsens hypernatremia. Question 46. A patient receiving intravenous potassium reports severe pain and redness at the peripheral intravenous site. What is the nurse's priority action? A. Stop the infusion and restart at a new site. B. Apply ice to the IV site. C. Encourage oral potassium intake instead. D. Increase the IV rate to finish sooner. Correct answer. A. Rationale. Pain and redness indicate infiltration or phlebitis. Potassium is caustic. Infusion must be stopped and restarted safely elsewhere. Increasing rate is dangerous. Question 47. A patient with cirrhosis is prescribed spironolactone for ascites. Which finding requires immediate intervention? A. Serum potassium 5.8 milliequivalents per liter. B. Weight loss of 1.5 kilograms in 24 hours. C. Increased urine output. D. Mild fatigue. Correct answer. A. Rationale. Spironolactone is potassium sparing. Hyperkalemia greater than 5.5 requires urgent intervention due to dysrhythmia risk. Weight loss and increased urine output indicate improvement. Question 48. A patient with severe diarrhea has sodium 130 milliequivalents per liter, potassium 2.7 milliequivalents per liter, and muscle weakness. Which prescription should the nurse question? A. Administer IV potassium chloride. B. Start 0.9% normal saline. C. Administer loperamide. D. Start continuous furosemide. Correct answer. D. Rationale. Furosemide worsens hypokalemia and hyponatremia. Diuretics are contraindicated until electrolytes stabilize. Question 49. A patient receiving magnesium sulfate for preeclampsia has a respiratory rate of 9 per minute and absent deep tendon reflexes. Which action should the nurse take first? A. Stop the infusion. B. Increase the magnesium infusion rate. C. Encourage slow, deep breathing. D. Monitor blood pressure hourly. Correct answer: A. Rationale. Signs indicate magnesium toxicity. Infusion must be stopped immediately. Calcium gluconate administration and airway evaluation follow. Question 50. A patient with heat stroke arrives with sodium 152 milliequivalents per liter, dry mucous membranes, and tachycardia. Which treatment should the nurse anticipate? A. IV hypotonic saline administration. B. Fluid restriction. C. Increased dietary sodium. D. Continuous diuretic infusion. Correct answer: A. Rationale. Hypernatremia from dehydration requires gradual replacement with hypotonic fluids. Restricting fluids worsens dehydration. Question 51. A patient with small bowel obstruction has been NPO with NG suction for 48 hours. Labs show sodium 133 milliequivalents per liter, potassium 2.9 milliequivalents per liter, and chloride 87 milliequivalents per liter. Which intervention is the nurse's priority? A. Administer IV potassium replacement as prescribed. B. Encourage oral electrolyte intake. C. Discontinue NG suction immediately. D. Increase the patient's daily sodium intake. Correct answer: A. Rationale. NG suction causes potassium loss, increasing dysrhythmia risk. IV potassium replacement is the priority. Sodium is only mildly low and not urgent. Stopping suction may worsen obstruction. Question 52. A patient who recently started ACE inhibitor therapy reports weakness and palpitations. Serum potassium is 6.0 milliequivalents per liter. Which action is the nurse's priority? A. Initiate continuous cardiac monitoring. B. Encourage potassium-rich foods. C. Hold the medication and recheck potassium tomorrow. D. Give a thiazide diuretic immediately. Correct answer: A. Rationale. Hyperkalemia increases risk for fatal dysrhythmias. Cardiac monitoring prevents unrecognized arrhythmias. ACE inhibitors can cause potassium retention, so dietary potassium is contraindicated. Question 53. A patient with heart failure is receiving IV furosemide. Which finding indicates the medication is working effectively? A. Weight decreases by 1.5 kilograms in 24 hours. B. Serum sodium decreases from 138 to 132 milliequivalents per liter. C. Serum potassium decreases from 4.1 to 3.2 milliequivalents per liter. D. Heart rate increases from 88 to 104 beats per minute. Correct answer: A. Rationale. Weight loss reflects reduced fluid retention. Hypokalemia and increased heart rate indicate adverse effects. Sodium decline may indicate dilutional imbalance. Question 54. A patient presents with confusion, nausea, and muscle cramps. Labs show sodium 117 milliequivalents per liter. Which provider order should the nurse question? A. Start D5W at 100 milliliters per hour. B. Initiate seizure precautions. C. Obtain frequent neurological assessments. D. Administer 3% saline per protocol. Correct answer: A. Rationale. D5W becomes free water, worsening hyponatremia. Severe symptomatic hyponatremia requires hypertonic saline and close monitoring. Question 55. A patient with COPD is receiving 0.9% normal saline at 150 milliliters per hour. The nurse notes new edema, crackles, and dyspnea. What is the priority action? A. Slow the IV rate and notify the provider. B. Encourage coughing and deep breathing. C. Increase the IV rate to correct dehydration. D. Provide high sodium foods. Correct answer. A. Rationale. New respiratory compromise indicates fluid overload. Adjusting fluids prevents worsening pulmonary edema. Breathing exercises do not treat the cause. Question 56. A patient admitted with severe vomiting has the following ABGs: pH 7.49, PaC 240 millimeters of mercury, bicarb 33 milliequivalents per liter. What electrolyte imbalance should the nurse anticipate? A. Hypokalemia. B. Hypernatremia. C. Hypercalcemia. D. Hypermagnesemia. Correct answer. A. Rationale. Metabolic alkalosis from vomiting leads to potassium shifting into cells, causing hypokalemia. Other electrolyte changes are less directly associated. Question 57. A patient receiving IV calcium chloride suddenly reports burning at the IV site, and the site appears pale and cool. What is the nurse's priority action? A. Stop the infusion and remove the IV catheter. B. Elevate the extremity and continue infusion. C. Flush the IV site with saline. D. Apply heat and reassess in 30 minutes. Correct answer. A. Rationale. Calcium chloride is highly vesicant and cool. Pale skin suggests extravasation. Stop infusion immediately to prevent tissue necrosis. Flushing worsens damage. Question 58. A patient with a serum phosphorus level of 1.8 milligrams per deciliter due to alcoholism is being treated. Which finding indicates improvement? A. Stronger diaphragmatic movement and improved ventilation. B. Decreased urine output. C. Increased deep tendon reflexes. D. Heart rate increases to 120 beats per minute. Correct answer. A. Rationale. Hypophosphatemia impairs muscle and respiratory function. Improvement in ventilation reflects successful phosphorus replacement. Question 59. A patient receiving TPN suddenly develops shortness of breath, chest pain, and tachycardia. The central line insertion site dressing is loose. What is the nurse's priority action? A. Clamp the catheter and place the patient in left Trendelenburg position. B. Remove the catheter immediately. C. Increase the TPN infusion rate. D. Apply warm compresses to the chest. Correct answer. A. Rationale. Symptoms suggest air embolism. Left Trendelenburg traps air in the right atrium and prevents circulation. Removing the catheter may worsen air entry. Question 60. A patient with severe dehydration has sodium 149 milliequivalents per liter, serum osmolality 310 millismoles per kilogram, and dry mucous membranes. Which IV fluid order should the nurse anticipate? A. 0.45% normal saline. B. Lactated Ringer's solution. C. 3% hypertonic saline. D. 5NS. Correct answer. A. Rationale. Hypernatremia with dehydration requires gradual correction using hypotonic fluids like 0.45% NS. Hypertonic saline worsens hypernatremia. Question 61. A patient with a traumatic brain injury has urine output of 500 milliliters per hour, serum sodium 158 milliequivalents per liter, and urine specific gravity 1.002. Which action is the nurse's priority? A. Prepare to administer desmopressin as ordered. B. Restrict the patient's oral fluid intake. C. Encourage high sodium foods. D. Discontinue IV fluids immediately. Correct answer, A. Rationale. Large urine output, dilute urine, and hypernatremia indicate diabetes insipidus. Desmopressin replaces deficient ADH. Fluid restriction worsens hypernatremia. Question 62. A patient receiving chemotherapy develops muscle cramps, nausea, peaked T waves, and K plus 6.4 milliequivalents per liter. The provider suspects tumor lysis syndrome. What is the nurse's priority? A. Administer intravenous calcium gluconate as ordered. B. Encourage increased oral potassium intake. C. Continue chemotherapy infusion. D. Place the patient in high Fowler's position. Correct answer, A. Rationale. Calcium gluconate stabilizes the myocardium in severe hyperkalemia, preventing lethal arrhythmias. Positioning does not treat the underlying emergency. Question 63. A patient with crush injury presents with dark tea-colored urine, oliguria, and K plus 6.1 milliequivalents per liter. What intervention should the nurse anticipate? A. Aggressive 4-isotonic fluid administration. B. Fluid restriction to reduce edema. C. Initiate potassium supplementation. D. Encourage ambulation and oral hydration only. Correct answer, A. Rationale. Rhabdomyolysis causes myoglobin-induced kidney injury and hyperkalemia. Rapid fluid resuscitation prevents renal failure and promotes clearance. Question 64. A patient 24 hours post-thyroidectomy reports tingling around the mouth and difficulty breathing. The nurse notes inspiratory stridor. What is the priority action? A. Prepare to administer intravenous calcium gluconate. B. Offer the patient warm fluids. C. Encourage slow, deep breathing. D. Reassure the patient this is expected. Correct answer, A. Rationale. Stridor indicates severe hypocalcemia, related laryngeal spasm, and airway emergency requiring immediate intravenous calcium. Reassurance delays treatment. Question 65. A patient with a history of chronic laxative use presents with potassium 2.6 milliequivalents per liter, pH 7.48, and muscle weakness. Which prescription should the nurse question? A. Continue daily laxative therapy. B. Administer intravenous potassium replacement. C. Place the patient on continuous cardiac monitoring. D. Assess bowel elimination patterns. Correct answer, A. Rationale. Laxatives worsen potassium loss and metabolic alkalosis. Therapy should be discontinued until electrolyte balance is restored. Question 66. A long-term care patient receiving concentrated tube feedings develops sodium 155 milliequivalents per liter, confusion, and dry mucous membranes. What is the nurse's priority action? A. Provide ordered free water flushes. B. Decrease sodium intake in meals. C. Increase tube feeding rate. D. Stop all enteral nutrition. Correct answer, A. Rationale. Hypernatremia from dehydration due to concentrated feedings requires water replacement. Stopping feedings does not correct the deficit. Question 67. A postoperative patient has abdominal distension, blood pressure 84 over 46 millimeters of mercury, heart rate 124 beats per minute, and urine output 12 milliliters per hour. No external fluid losses are noted. What is the nurse's priority? A. Administer isotonic IV fluids as ordered. B. Restrict IV fluids until labs return. C. Ambulate the patient immediately. D. Apply abdominal binders. Correct answer, A. Rationale. Findings indicate third spacing and hypovolemic shock. Rapid isotonic fluid resuscitation restores circulating volume and organ perfusion. Question 68. A patient taking lithium presents with excessive thirst, polyuria, sodium 150 milliequivalents per liter, and urine specific gravity of 1.003. What is the nurse's priority action? A. Notify the provider of suspected nephrogenic diabetes insipidus. B. Restrict oral fluids to 500 milliliters per day. C. Encourage high sodium foods. D. Hold all urine output measurements. Correct answer A. Rationale. Lithium can cause nephrogenic diabetes insipidus, leading to dilute urine and hypernatremia. Provider notification ensures medication adjustment and treatment initiation. Question 69. A patient receiving 3% saline for hyponatremia has sodium increase from 114 to 128 milliequivalents per liter in 6 hours. Which action is the nurse's priority? A. Stop the infusion and notify the provider immediately. B. Continue infusion until sodium reaches normal range. C. Encourage oral fluid intake. D. Administer a diuretic immediately. Correct answer A. Rationale. Rapid sodium correction increases risk of osmotic demyelination syndrome. Infusion must be stopped to prevent neurological injury. Question 70. A marathon runner collapses after the race with confusion, headache in sodium 118 milliequivalents per liter. The patient reports drinking gallons of water. Which intervention should the nurse anticipate? A. Administer hypertonic saline cautiously. B. Encourage further oral hydration. C. Administer hypotonic IV fluids. D. Provide salt-free nutrition. Correct answer. A. Rationale. Exercise-associated hyponatremia from excessive water intake causes cerebral edema. Hypertonic saline is required for symptomatic severe hyponatremia. Question 71. A patient with newly diagnosed myasthenia gravis becomes increasingly weak, has difficulty swallowing, and develops a respiratory rate of 30 per minute with shallow breathing. What is the priority action? A. Hold all scheduled medications. B. Notify the provider and prepare for possible intubation. C. Encourage the patient to rest and limit activity. D. Administer scheduled pyridostigmine immediately. Correct answer. B. Rationale. The patient is showing signs of myasthenic crisis with impending respiratory failure. Airway protection and preparation for ventilatory support are priority. Administering pyridostigmine, D, may worsen crisis symptoms. Rest, C, is insufficient. Question 72. A patient receiving continuous bladder irrigation after TURP surgery suddenly reports abdominal distension and severe suprapubic pain. The outflow tubing shows minimal drainage. What is the priority action? A. Increase the irrigation infusion rate. B. Manually irrigate the catheter to remove obstruction. C. Apply warm compresses to the suprapubic area. D. Document findings and reassess in 30 minutes. Correct answer, B. Rationale. Sudden distension plus low output indicates catheter obstruction and risk of bladder rupture. Manual irrigation restores patency. Increasing irrigation worsens pain and pressure. Delaying action is unsafe. Question 73. A patient with heart failure is receiving IV furosemide. The nurse notes PVCs on telemetry and potassium 2.7 milliequivalents per liter. What is the priority action? A. Administer potassium replacement per protocol. B. Decrease the furosemide infusion rate. C. Prepare to administer atropine. D. Document findings and continue monitoring. Correct answer, A. Rationale. Severe hypokalemia increases risk for lethal dysrhythmias. Potassium replacement is urgent. Simply decreasing diuretics does not resolve the emergent risk. Question 74. A patient with sepsis has received 4 liters of isotonic IV fluids. The nurse now notes bilateral crackles, bounding pulses, and new confusion. What is the priority action? A. Slow the IV infusion and notify the provider. B. Continue fluids to maintain perfusion. C. Administer acetaminophen for fever. D. Place the patient in high Fowler's position only. Correct answer, A. Rationale. New confusion plus crackles suggests fluid overload and decreased oxygenation. Stopping fluids prevents worsening pulmonary edema. Fever treatment C is not priority. Question 75. A patient with hypovolemic shock is receiving IV normal saline. Urine output increases from 10 to 35 milliliters per hour over the past 2 hours. Which finding indicates further improvement? A. MAP increases to 70 millimeters of mercury. B. Heart rate increases from 110 to 132 beats per minute. C. Skin becomes cool and mottled. D. Serum sodium rises to 155 milliequivalents per liter. Correct answer, A. Rationale. A MAP greater than or equal to 65 millimeters of mercury indicates adequate organ perfusion. Tachycardia, mottling, and hypernatremia indicate worsening shock or excessive sodium load. Question 76. A dialysis patient misses a scheduled treatment. Labs show potassium 6.8 milliequivalents per liter and peak T waves. What is the nurse's priority? A. Prepare to administer IV calcium gluconate. B. Encourage oral fluids to promote excretion. C. Schedule dialysis for the next morning. D. Offer low potassium dietary teaching. Correct answer, alpha. Rationale. Severe hyperkalemia with ECG changes is a cardiac emergency. Calcium gluconate stabilizes myocardial excitability. Education and fluids do not treat the acute threat. Question 77. A patient with severe malnutrition has phosphorus 1.2 milligrams per deciliter and shallow respirations. What is the priority intervention? A. Prepare to administer IV phosphate replacement. B. Encourage deep breathing and coughing. C. Increase dietary intake of whole grains. D. Restrict fluid intake until phosphorus normalizes. Correct answer, A. Rationale. Severe hypophosphatemia weakens respiratory muscles and can cause respiratory failure. IV replacement is urgent. Dietary changes alone are insufficient. Question 78. A patient with Cushing's syndrome has sodium 150 milliequivalents per liter, edema, and elevated blood pressure. Which provider order should the nurse question? A. Administer hypertonic saline. B. Monitor daily weights. C. Initiate fluid restriction. D. Review current corticosteroid dosage. Correct answer, A. Rationale. Hypertonic saline worsens existing hypernatremia and fluid overload. Monitoring weight, restricting fluids, and reviewing corticosteroids are appropriate. Question 79. A patient receiving IVD-5W at 125 milliliters per hour becomes restless and complains of a headache. Sodium is now 120 milliequivalents per liter. What is the nurse's priority action? A. Stop the infusion and notify the provider. B. Continue infusion and reassess in 1 hour. C. Increase the infusion rate to improve hydration. D. Administer an antiemetic medication. Correct answer, A. Rationale. D5W metabolizes into free water, causing dilutional hyponatremia and cerebral edema. Stopping the infusion prevents further sodium decline and neurological damage. Question 80. A patient receiving IV potassium through a peripheral line reports burning, and the nurse notes erythema and swelling at the site. What is the priority action? A. Stop infusion and restart IV at a different site. B. Apply ice and continue at a slower rate. C. Administer potassium via IV push instead. D. Elevate the extremity and reassess later. Correct answer A. Rationale. Potassium causes tissue necrosis if extravasation occurs. The infusion must be stopped and restarted in a new vein. IV push potassium is unsafe and contraindicated.